Assalamualaikum viewers and welcome back to my channel Biodinverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be continuing the same prevention and management of extraction complication. So in that series, our today's video will be about injuries to the adjacent osseous structure. That includes your maxillary tuberosity and your alveolar process. So in case of the fracture of the alveolar process, we first will be studying the cause, the prevention, and the management. So in case of the cause, there is usually the use of excessive forces with the forceps that leads to the fracture of the cortical plate. As we know that during our extraction procedure, we apply the buccolingual pressure with the forceps, and in that regard, if the pressure is excessive, it could lead to the fracture of either of the cortical plates of the alveolar process. So now as far as the prevention is concerned, if for example there is any case or there is any condition that demands the excessive force to be delivered for the extraction of that tooth, so you need to change your treatment protocol. You need to switch on to the open technique instead of the closed technique. In the open technique, you could reflect the soft tissue flap and after that remove the controlled amount of bone and in that case easily extract the tooth. Or in case of any multi-rooted tooth, section it, or in case of any divergent roots of the tooth, you can also section it in that case as well and go with the open technique. So common bones of the alveolar process that fracture includes the buccal cortical plate over the maxillary canine. So the buccal cortical plate over the maxillary canine is the most common bone of the alveolar process that will fracture. Secondly, the buccal cortical plate over the maxillary molar, then portion of the floor of the maxillary sinus, the maxillary tuberosity, and the labial bone over the mandibular incisors. So these were some important and the common bones that could be fractured as a result of the excessive pressure application. So as far the prevention is further continued, we need to perform a careful preoperative examination and assessment of the alveolar process both clinically and radiographically. So in that regard, we first need to assess the roots, we need to assess the proximity to the sinus wall or its divergence. Then we need to also assess the tooth form, the thickness of the buccal cortical plate overlying the tooth, and the age of patient as well. As the age advances, the buccal cortical plate or the bones, they usually get less elastic, so there is a very high tendency that they could fracture under the minimum amount of pressure as well, or if it exceeds the threshold level. So now we will be discussing the management of the fracture of the alveolar process. So in the management, we have the two situations. It depends upon the type and severity of the fracture. In first case, if the bone it is completely removed with the tooth from the socket, so then what you have to do, you just have to smooth any sharp edges that were caused by the fracture with the bone file. After that, you could also remove the sharpness with the rongers. Then re-approximate the soft tissue flap over the remaining bone. Now in the second case, if bone remains attached to the periosteum, in that case, if this is such a case, then the surgeon he usually felt it due to his tactile sensation that the bone it is remaining attached to the periosteum. So in that case, the careful dissection of the bone from the tooth is done. The tooth it is stabilized with forceps, and number 9 sharp periosteal elevator it is used to separate the bone from the tooth. As for the tooth, it is removed and the soft tissue flaps they are reapproximated over the bone with suture. So there is more chances in this case that bone will heal in a more favorable rich form for prosthetic reconstruction. So it is very important that if the bone remains attached to the periosteum, it could be safe in that regard. Or if it just completely come out with the tooth root, so in that case it could not be safe, it is non-vital and you need to extract the tooth along with the bone. So this was all about the fracture of the alveolar process. Now we will be studying the fracture of the maxillary tuberosity. Same, we need to study the cause, the consequences, and then the management protocol. So what are the most common causes of the fracture of the maxillary tuberosity? So extraction of the unerupted maxillary third molar or extraction of the maxillary second molar if it is last tooth in the arch. In these cases, there are high chances that you could fracture the maxillary tuberosity. The consequences of the fracture of the maxillary tuberosity can be as follow: that retention of the maxillary denture is highly compromised because this was a supporting area. Oro-antral communication or fistula can also form due to the fracture of maxillary tuberosity. So now what is a treatment or management protocol for the fracture of maxillary tuberosity? Here again we have three cases. First of all, if the bone is remaining attached to the periosteum, then again dissect the tuberosity from the tooth by stabilizing the tooth with forceps and then elevation of the bone with the periosteal elevator. After that, the tooth it is removed and the soft tissue flap is reapproximated over the bone with the sutures. So this was the first case. In the second case, if the tuberosity it is excessively mobile and it cannot be separated from the tooth, so in that regard you could go for two options, that is splint the tooth to the adjacent teeth and defer the extraction for 6 to 8 weeks for healing to occur. And after that, remove the tooth afterwards with the open technique. The second option is the coronectomy. Section the crown from the roots and again defer the extraction for 6 to 8 weeks in order to healing of the root and the tuberosity. And after that, if the healing of the root and tuberosity has occurred, then you can go on with removing the roots again with open approach. The third case is that if the tuberosity is completely separated from the soft tissue. So in that case, smooth the edges of remaining bone, check for any oro-antral communication, and then if the oral-antral communication it is found, then you can go for the required management protocol for that. Then reposition the soft tissue flap and suture it on the remaining bone. So this was all about the treatment or management of the fracture of the maxillary tuberosity. I hope this video will be helpful for you all. Don't forget to subscribe to my channel for more videos and updates. Thank you.